Right now, there's probably a vitamin sitting in your cabinet that you think is keeping you healthy. You take it every morning, trusting the label, believing it's protecting your heart, your brain, your bones. But here's what nobody's telling you. That same vitamin could be silently stealing years from your life. I know, it sounds crazy, right? How could something we've been told is good for us actually be dangerous? Well, groundbreaking research from Johns Hopkins and the Mayo Clinic just revealed something shocking. Certain vitamins that millions of seniors take every single day are now linked to faster aging, heart damage, and even early death. And the worst part? Most people have no idea it's happening. But look, there's also hope here. Because while some vitamins are quietly working against you, there's one vitamin your body is desperately crying out for. And when you get it right, everything changes. Your energy comes back. Your mind sharpens. Your heart gets stronger. I'm Dr. Michael Reed from Purely Health, and today I'm going to walk you through exactly which vitamin you need to throw away immediately, and which one could add healthy, independent years to your life. According to a recent Harvard medical review involving over 160,000 adults, the vitamins we choose after 60 can either protect us or slowly poison us. There's no middle ground anymore. So if you're over 60 and you're taking any vitamins right now, drop a comment below and tell me which ones. Let's figure out together if they're helping you or hurting you. Because what I'm about to show you next might completely change the way you think about that morning pill you've been trusting for years. Okay, let's talk about the vitamin that's probably fooling you right now. It's sitting there in your medicine cabinet, maybe in a bottle labeled bone support or heart health. You've been taking it for months, maybe years, thinking you're doing something good for your body. But here's the truth that's going to shock you. High-dose calcium supplements. I know what you're thinking, calcium? But isn't that what keeps our bones strong? Isn't that what every doctor used to tell us to take? Yeah, they did. And that's exactly the problem. See, for decades, we were told that calcium pills were the answer to preventing fractures and osteoporosis. Doctors handed them out like candy. Commercials made it seem like you couldn't survive after 60 without them. But then, something disturbing started showing up in the research. Dr. Robert Jensen, a cardiologist from the Cleveland Clinic with over 28 years of experience, he told me something that still gives me chills. I've seen too many patients in their 70s come into the ER with chest pain, shortness of breath, and when we check their arteries, they're calcified, hardened, like concrete. And you know what the common thread was? Years of taking high-dose calcium supplements. Here's what's happening inside your body when you take too much calcium in pill form. Your body doesn't recognize it the same way it recognizes calcium from food. So instead of going to your bones where it's needed, it starts floating around in your bloodstream. And eventually, it begins to settle. Where? In your arteries, your heart valves, even your kidneys. It's like pouring cement into a river, slowly, quietly, until everything starts to harden and clog. And the scariest part? You won't feel it happening until it's already done serious damage. A massive study published in the Journal of the American Heart Association tracked over 61,000 women for more than 19 years. The results were terrifying. Women who took calcium supplements of 1,000 milligrams or more every day had a 22% higher risk of dying from heart disease compared to those who didn't. 22%. That's not a small number. That's your life on the line. Now, I'm not saying calcium itself is bad. Your bones do need it. Your muscles need it. Your nerves need it. But pills? High-dose synthetic calcium pills? They're a completely different story. Let me tell you about Dorothy, a 68-year-old woman from Michigan. She'd been taking 1,200 milligrams of calcium every single day for 7 years, because her doctor decades ago told her it would prevent fractures. But last year, she started feeling tired. Weak. Her legs would cramp at night. When her doctor finally ran a CT scan of her heart, they found something heartbreaking. Her coronary arteries were lined with calcium deposits. Her heart was struggling to pump blood through stiffened, narrowed passages. I thought I was protecting my bones, she told me through tears. I didn't know I was hurting my heart. And honestly, most people still don't know. They're taking these pills right now, thinking they're being responsible, when the truth is, they might be setting themselves up for a heart attack they never saw coming. So if you're taking calcium supplements, especially the high-dose kind, you need to hear what comes next. Because the damage doesn't stop at your heart. Alright. Let's dig into what's actually happening inside your body when you take these calcium pills. Because once you see this, you'll understand why so many doctors are now telling their patients to stop. Your body is incredibly smart, right? When you eat calcium-rich foods like yogurt, cheese, leafy greens, your gut knows exactly how much to absorb. It takes what it needs, and lets the rest pass through. It's a beautiful system. Balanced, natural. But when you swallow a 500 or 1000 milligram calcium pill, your body gets hit with this massive flood all at once. And here's the problem, your gut can't regulate it the same way. So all that extra calcium gets absorbed into your bloodstream whether your body needs it or not. Now, if your bones were starving for calcium, they'd grab it. But most seniors aren't actually calcium deficient. They're vitamin D deficient, which means their bones can't use the calcium even if it's there. So where does all that extra calcium go? Straight into your soft tissues, your arteries, your kidneys, your heart valves. Dr. Lisa Hartman, a vascular surgeon from Stanford, calls it the calcification cascade. She explains it like this. Imagine your arteries are supposed to be flexible like rubber hoses. But when calcium starts depositing on the walls, they become stiff, brittle, like old pipes ready to crack. And that's when the real danger begins. Stiff arteries can't expand and contract the way they're supposed to. Your heart has to work harder to push blood through. Your blood pressure goes up. Oxygen can't reach your organs as easily. Over time, this leads to heart attacks, strokes, and heart failure. A study from the National Institutes of Health followed over 2,700 adults for 10 years. They found that people taking calcium supplements had a 22% increased risk of having a heart attack, compared to those getting calcium from food alone. The researchers were clear. Supplemental calcium may promote cardiovascular calcification and increase cardiovascular risk. I'm not trying to scare you. I'm trying to protect you. Because there's also another silent danger most people never hear about. Kidney stones. When your kidneys have to filter all that excess calcium, they get overwhelmed. And calcium crystals start forming, sharp, painful stones that can block your urinary tract and cause agony. According to research from the Mayo Clinic, seniors taking high-dose calcium supplements are nearly twice as likely to develop kidney stones compared to those who don't. Take Gerald, a 71-year-old retired truck driver from Texas. He'd been taking calcium for bone health for 5 years. Then one night, he woke up with the worst pain of his life. Stabbing. Radiating from his back down to his groin. Emergency room. Kidney stone. 4 millimeters. I'd rather break a bone than go through that again, he told me later. His doctor's advice? Stop the calcium pills immediately. And here's what nobody tells you. Even if you stop taking calcium pills today, the damage that's already been done? It doesn't just disappear. Those deposits in your arteries? They're stubborn. They stay. Which is why what I'm about to share next is so critical. What happens when seniors take too much? Let me tell you about Richard. He's a 74-year-old grandfather from Pennsylvania, loves gardening, plays with his grandkids every weekend. For 8 years, Richard took calcium supplements religiously. 1,200 milligrams every single morning. His wife reminded him. Never missed a day. He thought he was being smart, proactive, protecting himself. But last spring, something changed. He started feeling exhausted, out of breath just walking to the mailbox. His chest felt heavy, tight. At first he blamed it on getting older. That's just what happens, he'd say. But his daughter insisted he see a cardiologist. The scan results came back, and Richard's world stopped. His coronary arteries were severely calcified. The calcium deposits had narrowed his blood vessels so much that his heart was starving for oxygen. The cardiologist looked him in the eye and said, "If we don't act now, you're looking at a major heart attack within months." Richard needed emergency surgery. A bypass. "I was trying to protect my bones," he told me afterward, his voice shaking. "I had no idea I was slowly killing my heart." And honestly, Richard's story isn't rare. It's happening to seniors all across America right now, and most of them have no idea. If you're still watching this and you've been taking calcium supplements, comment your age below and let me know. I want to know how many of you are hearing this for the first time. Now let me share another story, because this one hits different. Her name is Patricia, 69 years old, retired nurse from Ohio. She'd been taking calcium for 12 years. Never questioned it. It was just part of her routine. But then she started having these weird symptoms. Confusion, fatigue, nausea. Her doctor ran blood work and found her calcium levels were dangerously high. A condition called hypercalcemia. Too much calcium in the blood. It was affecting her kidneys, her brain, even her heart rhythm. "I'm a nurse," she said to me, tears in her eyes. I should have known better. I should have questioned it. But how could she know? The bottle said bone support. The ad said stay strong. Her doctor 20 years ago said, take calcium. Nobody warned her about the other side. The dangerous side. Research from the British Medical Journal analyzed data from over 24,000 people and found that calcium supplements increased the risk of heart attack by 31% in otherwise healthy adults. 31%. That's not a small risk. That's a life or death risk. So if calcium pills are this dangerous, what are you supposed to do? How do you protect your bones without destroying your heart? That's exactly what we're covering next. And trust me, the answer is simpler and safer than you think. The one vitamin your body is begging for. Okay, here's where everything shifts. Because while calcium pills are quietly harming millions of seniors, there's one vitamin that most people over 60 are desperately low on. And when you get enough of it, everything changes. Your bones actually get stronger. Your heart protects itself. Your muscles work better. Even your mood lifts. I'm talking about vitamin D3. Now, I know what you're thinking. I've heard about vitamin D before. I get sunlight. I'm fine. But here's the reality most seniors don't realize. After 60, your skin loses up to 75% of its ability to make vitamin D from sunlight. 75%. You could sit outside for an hour, and your body would only produce a fraction of what it used to. Plus, if you live anywhere north of Atlanta, from October to March, the sun's angle isn't even strong enough to trigger vitamin D production. Even if you're outside. Dr. Amanda Chin, an endocrinologist from the Mayo Clinic, puts it simply. Vitamin D deficiency is one of the most common and most overlooked health problems in older adults. And the consequences are devastating. Let me explain why this vitamin is so critical, especially for your bones. See, calcium can't do its job without vitamin D. They're partners. Vitamin D is what tells your gut to absorb calcium from food, and what tells your bones to actually use it. Without enough vitamin D, all the calcium in the world won't save your bones. It'll just float around your bloodstream, causing the exact problems we talked about earlier. A groundbreaking study from Tufts University followed over 2,600 seniors for 5 years. The results were stunning. Those with healthy vitamin D levels had 40% fewer fractures, stronger muscles, better balance, and a significantly lower risk of falling. But those who were deficient, they lost bone density faster, fell more often, and ended up in the hospital with broken hips, wrists, and spines. Let me tell you about Helen. She's a 72-year-old woman from North Carolina who came to see me last year. She'd been feeling weak, achy. Her bones hurt. She was afraid to walk on icy sidewalks because she felt so unsteady. I thought I was just getting old and fragile, she said. I ran a simple blood test. Her vitamin D level? Well, 12 nanograms per milliliter. When it should be at least 30, ideally 40 to 50. She was severely deficient. I started her on 2,000 IU of vitamin D3 every single day. Within 6 weeks, Helen called me almost crying with relief. I feel like myself again, she said. The aches are gone. I have energy. I'm not scared to move anymore. And here's the beautiful part. Vitamin D doesn't just protect your bones. According to research published in the Journal of Clinical Endocrinology, healthy vitamin D levels are linked to a stronger immune system, fewer colds and infections, better heart health, lower blood pressure and reduced inflammation, sharper brain function, lower risk of dementia and depression, even a longer lifespan. One Harvard study tracked over 18,000 men for 10 years and found that those with the highest vitamin D levels had a 42% lower risk of early death compared to those with the lowest. 42%. Think about that. This one vitamin, that most seniors are walking around without, could literally be the difference between a long, independent life and years cut short by fractures, weakness, and disease. If you're still here and this is making sense, drop a comment below and tell me, do you know your vitamin D level? Have you ever had it tested? Now look, I'm not saying vitamin D is a magic cure-all, but what I am saying is this. If you're over 60 and you're not taking vitamin D3, your body is struggling. Quietly. Every single day. But here's the thing, just knowing you need vitamin D isn't enough. Because if you take it the wrong way, at the wrong dose, or in the wrong form, you won't get the results you're hoping for. So let me show you exactly how to do this right. How to take it right, dosage, timing, form. Alright, let's get practical here. Because knowing you need vitamin D is one thing, but taking it the right way? That's where most people mess up. And I don't want that to happen to you. So here's exactly what you need to know. First, the form. Not all vitamin D is created equal. You want vitamin D3, also called cholecalciferol. That's the natural form your skin makes from sunlight. It's the form your body recognizes and uses best. Avoid vitamin D2, ergocalciferol. It's synthetic, less effective, and your body has a harder time converting it. Always look for D3 on the label. Second, the dosage. For most seniors over 60, you want between 2,000 to 4,000 IU per day. Now, I know that sounds like a lot. But remember, your skin isn't making vitamin D anymore. And most foods don't contain nearly enough. A recent study from Boston University found that seniors need at least 2,000 IU daily just to reach healthy blood levels. But here's the key, don't guess. Get your blood tested. Ask your doctor for a 25-hydroxy vitamin D test. If your level is below 30, you're deficient. If it's below 20, you're severely deficient and may need a higher dose initially to catch up. Because taking too little won't help you, but taking the right amount? That's when you start feeling the difference. Third, timing matters. Vitamin D is fat-soluble. That means your body absorbs it best when you take it with food that contains some healthy fat. So take your vitamin D3 with breakfast if you're having eggs or avocado, or with dinner if you're eating salmon or olive oil. Don't take it on an empty stomach. You'll waste most of it. Fourth, pair it smart. Vitamin D works even better when you combine it with two other nutrients, magnesium and vitamin K2. Magnesium helps activate vitamin D in your body. Without enough magnesium, vitamin D just sits there, inactive. And vitamin K2? It makes sure the calcium that vitamin D helps you absorb goes to your bones, not your arteries. Think of them as a team. Vitamin D, magnesium, and K2. Together, they protect your bones and your heart at the same time. Dr. Samuel Brooks, a geriatric specialist from Johns Hopkins, explains it beautifully. Vitamin D alone is good. But vitamin D with magnesium and K2? That's when we see bones rebuild, energy return, and patients truly thrive. Now one more thing. Be patient. Vitamin D isn't a quick fix. It takes about 8 to 12 weeks for your levels to rise and for you to start feeling the benefits. But when you do, you'll notice more energy, stronger muscles, better balance, fewer aches. And the transformation doesn't stop there. Because when your body finally has the vitamin D it's been craving, the changes that happen next are nothing short of life-changing. Let me show you what I mean. So now you know the truth. The vitamin you thought was protecting your bones, high-dose calcium supplements, could actually be hardening your arteries, straining your heart, and stealing years from your life. And the vitamin most seniors are desperately low on, vitamin D3, is the one that can truly rebuild your strength, protect your bones, sharpen your mind, and help you stay independent for years to come. I'm not here to scare you. I'm here to empower you. Because every choice you make after 60 matters. Every pill, every meal, every decision. And the beautiful thing? You have the power to change direction today. Stop the calcium pills if you're taking high doses. Talk to your doctor. Get your vitamin D level tested. Start supplementing with D3 the right way. 2,000 to 4,000 IU daily with magnesium and K2, taken with food. Do that, and within weeks you'll start feeling the difference. More energy, stronger bones, a clearer mind, a body that finally feels like it's working with you instead of against you. Dr. Ellen Morrison, a geriatric physician with over 32 years of experience, says it best. Aging doesn't mean declining. It means learning what your body truly needs, and giving it exactly that. For patients who follow this simple truth, they don't just live longer, they live better. So tonight, as you look at those bottles in your cabinet, ask yourself this: is what I'm taking helping me heal, or quietly harming me? Because the answer to that question could change everything. If this video opened your eyes today, do me a favor. Hit that like button. Share this with someone you love who needs to hear it. And subscribe to Purely Health so you never miss life-saving information like this.